Hello, everyone. Welcome back to Healthcare Experience Matters. I am so excited for our guest today, Jody Thomas, PhD. She is the CEO of Meg Foundation and a licensed clinical psychologist, as well as an adjunct lecturer with the Stanford University School of Medicine. So, we're going to be talking a lot about the use of language. Some really important resources are available that Dr. Thomas has been a huge part in creating. So she is a huge expert on this topic. I'm going to turn the microphone over to her now and just have her tell us a little bit about her professional journey and what brought her to where we're at today.
I will try to be as succinct as I can. Thank you so much for having me here. Basically, so I am a clinical psychologist and have been working with primarily kids and families in medical settings for the past 25 plus years. And along that way, really trying to find all the ways that we can improve the patient experience, improve the provider experience, and improve the collaboration between the two as much as we can. So very early on, I became interested in actually clinical hypnosis became a huge interest. So I'm actually now co-director of curriculum for the National Pediatric Hypnosis Training Institute. And the focus of that is really on language and how we use our words to create focus and attention to make that better. So I developed and ran the pediatric pain rehab program at Stanford, and then really became interested in how do we use technology and design to bring good information to kids and families everywhere, and to give providers the information and resources they need to make their jobs easier and to make them even more effective with patients. And that really led to the founding of the Meg Foundation, which is a nonprofit dedicated to doing exactly that.
And we will include a link to Meg Foundation's website in the description of this podcast, Meg Foundation for Pain.org. How does the use of language from healthcare providers, how does that actually impact the patient experience? Let's start there.
Well, it impacts it honestly in every way because what we say and how we say it reflects our intention and creates a set of expectations. So, whether or not a provider understands that's what's happening or not, it is happening. And so, what we're talking about is using that with intention to create a better experience. But it is the difference between saying things like, you have to go to the shot, you have to go to the doctor and get a shot versus we get to go to the doctor and get some magic medicine that helps keep you healthy and strong. So, how we say and how we frame things, from whether or not they're going to experience more pain during a procedure to whether or not they have expectations about how recovery would go, how recovery from surgery would go, or their course of treatment, our use of language and the research would say really has a very important role in those outcomes.
And we love learning from examples and stories on this podcast. So, is there any way you can share some specific examples of how the intentional use of language can actually transform communication between providers and patients?
Absolutely. So there's a million examples. Some of my kind of favorite, most dramatic examples are things we found out when there were studies on how like EMTs respond to heart attack victims in the field. And the difference between someone saying, I'm having a heart attack, and you saying yes, and they're like, oh my God, I'm having a heart attack. Now we're anxious versus being able, and so of course, then we're worsening outcomes, we're increasing anxiety versus saying, yes, you are having a heart attack, but we see this every day. We know it's going to happen. We're going to get you to the hospital and you're going to be just fine. Where we've created a framework where they can feel safe and okay. That difference between, I know there's a phenomenal study looking at like colorectal exams and this, when you say we're going to start the procedure now versus we're going to insert the tool now. Those two phrases, very different on the emotional and physiological reaction that's occurring in that patient. And we actually look at things like their perceived distress, how they're feeling about it, their reports of pain, their how long those procedures take is really going to be determined by that use of language to frame it. Elvira Lang does some amazing work in her stuff on comfort talk about what we say pre-procedurally and pre-surgically that can predict the amount of outcomes on pain medicine use and hospitalization length. So the data is pretty crazy. But we also have things like I remember being back when I was a trainee and I was starting a pain program at Children's Hospital Orange County. And I had this amazing phlebotomist that worked with kids in the hematology clinic. And she would do a beautiful job of building this rapport and starting these kids on for like an infusion or blood work. And the last thing she started saying was, get ready for the ouch. And on the word ouch, the kid would start crying because we've literally told them this is where the distress happens. And I had to come in and be like, you know what? All this is beautiful, but if we can get rid of the ouch, then, and once she switched that language, these kids did beautifully. And we saw their distress go away. And they were given this opportunity then to cope successfully with these experiences. So it really kind of goes across the board from setting those kids up from, I'm going to take this arm instead of your arm, which encourages dissociation when we're going to be sitting there doing, you know, a poke or a procedure or something that we're giving them permission to not pay attention to the thing that we don't actually want them to pay attention to at that moment.
Oh, those are really, really great examples. Tell me more about some guidelines or strategies that you recommend healthcare providers kind of educate themselves on to enhance their language and overall communication skills with patients.
Well, there's some phenomenal resources out there for learning different things, like the National Pediatric Hypnosis Training Institute is a great place to go and learning skills in motivational interviewing. Again, Elvira Lang's Comfort Talk is a great program. But even if we're not able to or willing to invest in that level of training at this point, there are very simple things that we can do that really make a difference. Like learning how to ask questions more effectively. So it's the difference between saying, what have you already done? What have you taken for your pain? Versus what have you already figured out helps you feel better? That when we're framing the question differently. So one of the things that I'll encourage people to do is really just think of a few phrases that you have learned that are going to be easier to fit into your clinical intervention. So when I'm working with providers being like, okay, talk to me about something that happens that you do on the regular, even sometimes multiple times a day. And let's talk about 3 different changes of phrase you could use. And I want you to notice how much differently it goes when we use that phrase. And so it doesn't have to be this major undertaking of transforming your health, your communication with your patients, but really picking a few phrases or a situation or two where we can switch, right? So that's what we often do when I'm training providers. I've trained providers all over the world. And we've actually created some guides on the Meg Foundation website for this exact purpose, right? You're like, yes, I would love for you to go and get these amazing trainings and totally transform, but that's not realistic. What I want instead for you to notice how powerful when you're changing that focus of attention, you are changing the experience. And we have to remember one of the easiest ways to think about it is trauma and medical trauma. And that's really what we're talking about in anxiety and trauma and healthcare settings is about feeling helpless, uncertain, and incapable in the face of a perceived stressor. And if we can change our language to address those things, then we are transforming everything. So by that, I mean like, okay, I want you to know what's going to happen next. Because if we don't understand what's going to happen, we as providers get into this thing where, you know, this is what we do every day. It's our bread and butter. It's our thing. And I'll show this picture in trainings of like a beautiful little hiking trail. And that's how we go. That's how we go along. And then I'll show this picture of a trail where it's kind of dark and foggy and misty, and it's that movie scene, scary trail. And I'm like, this is what it's like for our patients because they don't know the terrain. Now, there's no distinct threat out there, but we're uncertain. And when we're uncertain, we're hypervigilant and we're anxious. And when we can sit there and say, hey, I know how this goes. I'm going to explain it to you along the way, and we're taking away that uncertainty, we're taking away that power. And our language is going to do that. We also give them a way to cope and show confidence in their capability, being like, oh my gosh, that was great. Yeah, mom, definitely hold that hand. And you're doing just what's right now to help comfort your kid. That's amazing. Good job, buddy. Yep, you're going to look away from the procedure. That's a phenomenal way to take care of yourself. Good job. You know just what to do. When we are communicating that confidence in their capacity, we totally transform what's going on when we kind of get ourselves out of our own world and connect with their experience. And by the way, this makes your life and job easier, right? We want to get through this better. We obviously care about patient care. We wouldn't be in this field to begin with, but it also makes your job easier and better. One of the other big things we talk about is using humor and the element of surprise, and the is incredibly powerful. So, as an example, for years I worked in emergency rooms, and I'm called in as a psychologist instead of when I'm getting called in, the situation is way out of control, right? This is I'm not being called in the beginning. I'm like, it's a mess. And one of the things I would do is usually there's a hysterical kid, and everyone else is pretty amped up as well. And I would get to come in, and they're basically on a train. I think about that train headed towards the cliff, and we're there. And it's really that job of just getting off the train. How are we going to change this? And I would come in often and say things like, you know what? You are an amazing crier. That is incredible. You are that's amazing. Could you cry a little bit louder? And just by the fact that, I'm now the crazy lady who has entered the room, right? They're like, wait, what? What are you talking about? Everyone here is getting me to shut up and be quiet and calm down. And you're asking me to cry louder. But one, I've caught their attention. But two, I've introduced the possibility that they have control over what they're doing and saying. Because if we can cry louder, we can cry softer. And by capturing their attention and allowing this to refocus, we've again changed that situation. And the other thing we really want to think about is the most control that we can give a patient, the better. Now, they might not have control that this bad thing is happening to them, or they have to get stitches, or they have to get this test done, or even we have to start treatment. But the most control that choice is power, and power reduces anxiety. So, do you want it in this arm, in this arm? What video do you want to watch? Why we're going to do this? Where do you want mom to sit and do? Would you like me to be here alone, or is it okay if my friend, the med student or the nurse or whoever is here? That the moment we give choice, we are handing and sharing that power with the patient, and that is going to make it go better for everyone involved.
Jody Thomas, PhD. She is the CEO with Meg Foundation. Meg Foundation for Pain.org is the website. She's a licensed clinical psychologist, and she's also an adjunct lecturer with Stanford University School of Medicine. Dr. Thomas, thank you so much for your time.